Hello, good day to each and everyone. We are the Group 2 from BSN 111F from Davao Doctors College, and today we are going to report our worksheet number 7, which is all about the endocrine, digestive, urinary, and reproductive system. Hi, my name is Deborah S. Capitan, and I will be your first reporter for today. So first, we are going to tackle the functional anatomy of the endocrine glands. So we are going to start with the gross anatomy and basic function of the endocrine glands. So the endocrine and nervous system are major regulating systems of the body. However, the nervous system has been compared to an airmail delivery system and the endocrine system to the Pony Express. So our answer is this is because the nervous system uses nerve impulses to bring rapid control. The endocrine system acts much more slowly. The endocrine glands produce hormones and release them into the blood to travel to relatively distant target organs. Next, define hormone. So hormone is a chemical substance produced in the body that controls and regulates the activity of a certain cells or organs. Next, identify the endocrine organ described by the following statements. So, it is the endocrine organ located in the throat by lobe gland connected by an isthmus. So, our answer is the thyroid gland. Next is found at the top of the kidney. Our answer is the adrenal gland. Next is the amyx gland located close to the stomach and small intestine. Our answer is pancreas. Next is the found in the roof of the third ventricle of the brain. Our answer is the pineal gland. Next, ride horseback on the thyroid gland. Our answer is the parathyroid gland. Next, found in the pelvic cavity of the females concerned with ova and female hormone production. Our answer is ovary. Next question, although the pituitary gland is often referred to as the master gland of the body, the hypothalamus exerts some control over the pituitary gland. How does the hypothalamus control both anterior and posterior pituitary functioning? So our answer is it produces releasing and inhibiting which control the production and release of anterior pituitary hormones, form hormones ADH and oxytocin that are transported to the posterior pituitary and later released on nervous stimulation from the hypothalamus. Next, name the hormone whose production is in inadequate amounts result in the following conditions rather. So next, our for the first question, poor development of secondary sex characteristics, our answer is estrogen and testosterone. Next, tetany, our answer is PTH or the parathyroid hormone. Next is diabetes mellitus, our answer is insulin. Next, abnormally small stature, normal proportions, our answer is GH or the growth hormone. Next is the mycedema, a lower than normal metabolic rate. Our answer is thyroxine. Next is describing hormonal effects, identify the hormones involved. So there are keywords used in the that was given in our worksheet. So just refer for the definition of the numbers and the letters on the worksheet. So for the basal metabolism hormone, hello, nakat ko.
Wala, Deb.
Wala, Deb.
Hi, okay. So for the basal metabolism hormone, our answer is 17J. 17 stands for T4, T3, and J stands for the thyroid gland. Next is it regulates blood calcium levels. Our answer is 15G and 4J. 15G stands for PTH or the parathyroid gland, and G stands for the parathyroid gland. For J, our number 4 is the calcitonin, and it is in the thyroid gland. Next is health maturity lymphocytes. So 19, it is the hormones responsible for this is the thymosin, and its site of production is in thymus. Next is drive development of secondary sexual characteristics. Our answer is 16I. So the hormone is the testosterone, and letter I, the site of production, is the testes. Next is regulate the function of another endocrine gland. Our answer first is the 1C. First hormone is the ACTH, and the site of production is the anterior pituitary. Next is 7C. 7 is the hormone FSH, and it is also in the anterior pituitary. Next is the 11C. It is the LH, and it is also in the anterior pituitary. And lastly, 18C. TSH, and it is also in the anterior pituitary. Then next, mimic the sympathetic nervous system. Our answer is 5B. The hormone is the epinephrine, and its site of production is in the adrenal medulla. Next is the 8F and 10F. So regulate blood glucose levels produced by the same mixed gland. So 8 is the hormone glucagon, and the site of production is pancreas. And 10 is the insulin, and the same lang din yung site of production, pancreas. Next is directly responsible for regulating the menstrual cycle. Our answer is the FSH, and its site of production is the anterior pituitary. And the 11C, 11 stands for the LH, and it's in the anterior pituitary as well. Next is it helps maintain salt and water balance fluids. Our answer is number 3, aldosterone, and the letter is I. The site of production is the adrenal cortex. Then next is 2D, the ADH hormone, and the site of production is at the hypothalamus. Lastly, the involved in milk ejection. So the hormone responsible or involved in this is the oxytocin, and its site of production is also in the hypothalamus. Observing the effects of hyperinsulinism. So briefly explain what was happening within the fish's body when the fish was immersed in the insulin solution. So our answer is glucose was being swept out of the blood into the cells. So this led to a hypoglycemic reaction which adversely affects nervous system functioning adversely. Next is what is the mechanism of the recovery process you observed? So our answer is glucose was added, increased glucose levels in the blood, reverse the effects above. Number 9, what would you do to help a friend who had accidentally taken an overdose of insulin? Why? So first, we will give him or her a glass of orange juice or soda. So a sugar source will increase blood glucose level. Number 10, what is a glucose tolerance test? So the glucose tolerance test, also known as the oral glucose tolerance test, measures your body's response to sugar or glucose. So the glucose tolerance test can be used to screen for type 2 diabetes. More commonly, a modified version of the glucose tolerance test is used to diagnose gestational diabetes, or a type of diabetes that develops during pregnancy. So that's it for my report. I will give the floor now to Ms. Sofia Altara Bermejo.
Hi, good day everyone. I am Sofia Altera Clasio Bermejo and I'm going to discuss about the functional anatomy of the digestive system. So for the question number 1, match each division of the digestive system with the statement that apply to each. For number 1, alimentary tube, our answer for that is A, C, F, and G. A stands for begin at the mouth. C is include the stomach, small intestine, and large intestine. F is digestion does take place in some organs, and G is the ends of the anus. For number 2, accessory organ, our answer for that is B, D, and E. B stands for include the teeth, tongue, and salivary glands. And E stands for no digestion take place here. So for number 2, name the parts of the alimentary tube in which digestions take place. Our answer for that are oral cavity, stomach, and small intestine. Number 3, Name the part of the alimentary tube in which most absorption of nutrients take place. Our answer for that is small intestine. So for the next part, the following diagram depicts the digestive system. Label the parts indicated. So as you can see on your screen, this one is your teeth, this one is the oral cavity, the tongue, the sublingual gland, the wait lang. Oh my god, the submandibular gland, the parathyroid gland. This one is your esophagus. This number 7 is the right lobe of the liver. Number 8 is the gallbladder. Number 9 is the common bile duct. Number 10 is the duodenum. 11 pyloric sphincter. Number 12 ascending colon. Number 13 is jejunum. 14 is small intestine. 15 cecum. 16 appendix. 17 sorry 18 left lobe of the vulvar, 19 stomach, 20 transverse colon, 21 pancreas, 22 descending colon, number 23 sigmoid colon, 24 rectum, and 26 anus. So for the next part, types of the digestion and ends products of the digestion. Number 1, match the following type of the digestion with the proper descriptive statement. So for number 1, chemical digestion, our answer for that is B and C. For number 2, mechanical digestion, our answer for that is A and D. Number 2, name the end products of digestion of. Number 1 is fats. Our answer for that are fatty acids and glycerol. Number 2, proteins. Our answer is amino acids. Number 3, carbohydrates, and that is monosaccharides. Number 3, other nutrients released during the digestive system process are vitamins, mineral, and water. So for the next part, oral cavity and pharynx. Number 1, the opening for food into the oral cavity is the mouth. B, the superior boundary of the oral cavity is the hard palate. Number 1, both the teeth and tongue contribute to mechanical digestion into the oral cavity by what we call chewing. Number 2, an individual develops two sets of teeth. The first set is called the primary teeth and if complete consists of 20 teeth. B, the second set is called the permanent teeth and if complete consists of 32 teeth. 1. Number 1, match the following parts of a tooth with the proper description. So for number 1, enamel, our answer for that is C and E. For dentine, our answer is A. For number 3, pulp cavity, our answer is F. For number 4, periodontal membrane, our answer is B and D. So for the moving on to the next slide, the number 5, the tongue is important for the sense of taste. B, as the first step in swallowing, the tongue is developed to push food towards the pharynx. Number 6, name the pairs of salivary glands with these locations. Number 1, below the floor of the mouth, sublingual glands. Number 2, in front of the ears is the parotid glands. Number 3, at the posterior corners of the mandible, that is the submandibular glands. Number 7, the salivary glands are exocrine glands because they have ducts to have the saliva to the exocrine gland. Number 8, letter A, the digestion enzymes in saliva is amylase, which digests starch to sugar. Letter B, the water of saliva is important to dissolve food so that it may be digested. and to moisten a mass of food so that it may be swallowed. Letter C. The enzyme in saliva that inhibits the overgrowth of bacteria in the oral cavity is the amylase. So next is number 9. The only eating related function of the pharynx is what you call swallowing, which is reflex regulated by a center and the medulla oblongata of the brain. Moving on to the esophagus. Number 1, the esophagus takes food from the pharynx to the stomach. Number 2, letter A, at the junction of the esophagus and the stomach is circular smooth of the muscles called the lower esophagus sphincter. Letter B, contraction of this sphincter prevents the backed up of stomach into the esophagus. Next part is the typical structure of the alimentary tube. Number 1. Match each layer of the alimentary tube with a proper descriptive statement. So for number 1, mucosa, our answer for that is A, D, and F. Number 2, submucosa, our answer for that is C and G. Number 3, external muscle layer, our answer for that is E, H, and J. Number 4, serosa, that is B and I. Next, so the stomach. Number 1, the stomach is the sac-like portion of the alimentary tube that extends from the esophagus to the small intestine. Number 2, some digestion does take place in the stomach, which also serves as a reservoir for food so that digestion take place gradually. Number 3, letter A, the folds if the gastric mucosa that are present when the stomach is empty are called the ragae. Letter B, the glands of the stomach are called the gastric gland and their secretion is called gastric juice. Number 4, match the following cells of the gastric pits with their proper secretion. For number 1, the mucous cells, letter C. Number 2, chief cells, letter A. Number 3, parietal cells, letter B. And number 4, letter G, cells, D. So that's it for my discussion. I'll be passing the mic to Miss Felicity Di Carlos. Thank you.
Did,
Beb,
did,
naa pa,
napa
Beb.
kay
Duha
isa.
ka slide. Duha
Duha.
ka slide
Ay,
pa, Beb.
oo.
Ay, naposto.
Wala.
Sige, padayon na
Sige
to
lang,
eh.
go.
So, moving on to the stomach. Hala letter A, the part of the gastric juice that kills the most microorganism that enters the stomach is hydrochloric acid. Letter B, the part of gastric juice that digests proteins, the polypeptides, is the enzymes. It is the pepsin. Number 6, letter A secretion of gastric juice may begin with the sight of smell of food. This is a parasympathetic response. Letter B, when food actually reaches the G cells of the gastric pits secrete the hormone of gastrin, which stimulates the secretion of more gastric juice. Number 7, letter A, mechanical digestions in the stomach is a function of external muscles layer of the wall of the stomach. Letter B, the pyloric sphincter is located at the junction of the pylorus of the stomach and the duodenum of the small intestine. Letter C, when the pyloric sphincter contracts, it prevents the backup of food from the duodenum to the stomach. Next slide, please. So, the following diagram depicts a partial longitudinal section of the stomach. So here in your screen, label the esophagus. Number 1, esophagus. Number 2, the cardia. Number 3, lesser curvature. Number 4, the pyloric sphincter, which or valve. Number 5, duodenum. Number 6, the fundus. 7 is the longitudinal layer. Number 8, circular layer. Number 9, oblique layer. Number 10, lumen greater. 11, curvature. Number 11, greater curvature. Number 12, ragae of mucosa. And lastly, 13, pyloric canal. So that's it for my topic, guys.
So thank you, Miss Sofia Bermejo. I am Felicity B. Carlos, and I will continue the reporting. As for the liver and the gallbladder, number 1A, the liver is located just below the diaphragm in the upper right and the center of the abdominal cavity. B, the functional unit of the liver is called a liver lobules, which is made of liver cells and the large capillaries called hematocytes. C, between liver lobules are branches of the hepatic artery, the portal artery, the vein, and the bile ducts. Number 2, the digestive function of the liver is the production of bile, which contains bile salts that emulsify fats. B, this is an aspect of chemical digestion. Number 3, bile leaves the liver through hepatic duct, which joins the cystic duct of the gallbladder to form the common bile duct, which carries bile to the duodenum of the small intestines. Number 4, bile also has an excretory function because bilirubin and the excess cholesterol are transported to the intestines to be eliminated in feces. 5, the gallbladder is located on the undersurface of the right lobe of the liver. B, state the two functions of the gallbladder: store bile and the concentrates bile. 6A, the production of bile and the contraction of the gallbladder are regulated by hormones by the endocrine cells of the mucosa of the duodenum. Number 7, as you can see on the screen, the following diagram depicts the liver, gallbladder, and the pancreas. Number 1, gallbladder. Number 2, the cystic duct. Number 3, the common hepatic duct. Number 4, the descending part of the duodenum. Number 5, the major duodenal papillae. Number 6, the left lobe of the liver. 7, the common hepatic duct. 8, the stomach. 9, the pylorus. 10, the tail of the pancreas. 11, the pancreatic duct. Let's move on to the pancreas. Number 1, the pancreas is located in the upper abdominal cavity between the curve of the duodenum and the spleen. 2, pancreatic juice are carried by the main pancreatic duct to the common bile duct to the duodenum, which is their site of action. 3A, enzyme pancreatic juice contains several enzymes. The enzyme pepsin digests polypeptides to shorter chains of amino acids. B, the enzyme lipase digests emulsified fats to fatty acid and glycerol. C, the enzyme amylase digests starch to disaccharides. 4, the bicarbonate pancreatic juice contains sodium bicarbonate that neutralizes the hydrochloric acid from the stomach in the duodenum. The small intestine. Number 1A, the small intestine is coiled within the abdominal cavity and is encircled by the large intestines. B, the small intestine carries food from the stomach to the large intestine. Next slide, please. 2A, the three of the small intestines in order are the duodenum, the jejunum, and the ileum. B is the common bile duct. The common bile duct enters which of these parts? The answer is the duodenum. Number 3A, which layer of the wall of the small intestine is responsible for mixing chyme with digestive secretions and for peristalsis? The answer is external muscle layer. B. What is the collective name for all the nerve fibers and the networks of the alimentary tube? The answer is the enteric muscle layer. C. The name Peyer's patches is given the lymph nodes of the small intestine. 4. Digestion of food is completed in the small and requires bile from the liver. Enzyme pancreatic juice from the pancreas and the enzyme produces by the small intestines itself. 5a. The crypts of Lieberkühn are the glands of the small intestines. B. The secretion of these glands is stimulated by the presence of food in the duodenum. 6a. The digestive enzyme produced by the small intestines are sucrase, maltase, and lactase, which digest disaccharides to monosaccharides. Next, okay. So, B. The peptidases complete the digestion of peptide chains to amino acid. 7. The efficient absorption in the small intestine requires a very large surface area, which is provided by several structural modifications of the small intestine. Match each structure with its proper description. Number 1, the plica circularis is A. Number 2, the villi is the B. Number 3, microvilli is the C and D. 8. The villi of the small intestines contain the vessels into which the end of the products or nutrients of digestions are absorbed. Which villus contains a capillary network which absorbs the water-soluble nutrients and a latter which absorbs the fat-soluble nutrients. 9. Match of the following nutrients with the vessel in the villi in which is absorbed and the mechanism of absorption. Number 1, the amino acid is the A1. 2, the fat-soluble vitamins is the B4. 3, the water-soluble vitamins is the A1. 4, the fatty acids and the glycerol is the B4. Number 5 is the monosaccharides, A1. 6, the positive ions is the A1. 7, negative ions, A2. 8, water, A3. Number 10, A is the absorption of vitamins. B12 requires the intrinsic factor produced by the stomach linings. B, the absorption of calcium ions requires vitamin D and the parathyroid hormone. 11. A. Blood from the capillary network in the small intestine travels through the portal vein to the liver before returning to the heart. B. Lymph from the lacteals in the small intestines enter the blood in the subclavian vein. And that's all for my report, and I'm passing the floor to Miss hold on. Mr. Faisal.
Thank you, Fel. Now, a review of digestion. Number 1, complete the following charts by naming the digestive secretion and its action of each organ listed in the column under the proper food type. If an organ does not contribute to the digestion, if a food type, write none. Organ, salivary glands, carbohydrates, amylase, digest starch to maltose, fats, none, proteins, none. Next, stomach, for carbohydrates, none, fats, none, proteins, pepsin to polypeptides, HCI, pepsinogen to pepsin. Next, liver, carbohydrates, none, fats, bile salts emulsify fats, proteins, none. For pancreas, in carbohydrates, amylase digests starch to maltose, fats, lipase digest emulsified fats to fatty acids in glycerol, proteins none. For small intestine, carbohydrates none, fats none, and proteins peptidase converts peptides to amino acids. Number 2. The following diagram depicts digestion. Number 1, salivary amylases. Number 2, pancreatic amylases. Number 3, glucose, galactose, and fructose. Number 4, lipoprotein. Number 5, lipases. Number 6, pepsin. Number 7, trypsin. And number 6, protease. For large intestine, number 1, the large intestine is also called the colon and extends from the cecum at the small intestine to the rectum. Number 2, the first part of the colon is the cecum, to which the appendix is attached. Number 3, number the parts of the large intestine in order beginning with the cecum. Cecum, cecum 1, then rectum 6, ascending colon 2, sigmoid colon 5, descending colon 4. We have anal canal number 7, and transverse colon 3. The function of the colon are: number 1, the absorption of water, salt, and materials have not been digested as food. C. Another function of the colon flora is to produce vitamins, especially vitamin K. Number 6, letter A, the defecation reflex for the elimination of feces involves which part of the CNS? Spinal cord. Letter B, the stimulus for defecation is the stretching of the rectum as peristalsis of the colon pushes feces into it. Number 7, number the parts of the reflex are for the defecation reflex in proper sequence. 1. Stretch receptors in the rectum generate impulses. 4. The rectum contracts and the internal anal sphincter relaxes. 2. Sensory impulses travel to the spinal cord. 3. Motor impulses return to the smooth muscle of the rectum. Number 8. Voluntary control of defecation is provided by the external anal sphincter, which contracts to close the anus. The following diagram depicts the colon. So we have the right colic, hernia coli, Yostra, transverse colon, left colic flexure, the ascending colon, descending colon, ileum, the ileocecal valve, sigmoid colon, appendix, cecum, rectum, anal canal, and anus. Liver other functions. Number 1, with respect to liver functions, match each of the following with the proper description statement. Number 1, transamination. Our answer is letter J. Number 2, glycogen. Our answer is I, K. And number 3, synthesis of clotting factors, H. Number 4, beta oxidation, letter G. Number 5, A, D, E, K, and B12. Our answer is M. Number 6, fructose and galactose, B. 7, synthesis of albumin, C. 8, synthesis of enzymes, L. 9, dimination, E. 10, synthesis of lipoproteins. Our answer is A. 11, synthesis of bilirubin. Our answer is D. 13, iron and copper, N. And 14, copper cells. is letter K. Next, crossword. Across. Number 3, amino acids cannot be synthesized by the liver. Essential. Number 8, bile salts do this to large fat globules. Emulsify. Number 10, secretion of the parotid glands, saliva. Number 11, flora, the bacteria that live in the colon, normal. Number 12, take bile and pancreatic juice to the duodenum, common bile duct. Number 14, digestion, the physical breakdown of food, mechanical. Number 16, the first 10 inches of the small intestine, duodenum. Number 17, digestion accomplished by digestive enzymes, chemical. Number 19, prevents backup of fecal material into the ileum, ileocecal valve. Number 20, amino acids can be synthesized by the liver, non-essential. Down. Number 1, anchors a tooth in its socket, periodontal ligament. Number 2, involuntary response for elimination of feces, defecation reflex. Number 4, prevent backup of stomach contents, less. Number 5, prevents backup of intestinal contents, pyloric sphincter. Number 6, inflammation of the liver, often caused by viruses, hepatitis. Number 7, folds of the mucosa when the stomach is empty, rugae. Number 9, extends from the mouth of the anus, alimentary tube. Number 13, inflammation of the appendix, appendicitis. Number 15, folds of the mucosa of the small intestine, villi. Number 18, provides a hard chewing surface, enamel. Next, functional anatomy of the urinary system. Number 1, what is the function of the fat cushion that surrounds the kidney in life? Perirenal fat capsules anchor the kidneys to the dorsal body while in a retroperitoneal position and cushions it against blows. Number 2, identify the urine system organs. We have the renal vein, renal artery, kidney, ureter, urinary bladder, and urethra. 1. Maintains water and electrolyte balance of the blood. Kidney. Number 2. Serves as a storage area of urine, urinary bladder. Number 3. Transports urine to the blood exterior, urethra. Number 4. Transports arterial blood to the kidney, renal artery. Number 5. Produces urine, kidney. Number 6. Transports urine to the urinary bladder, ureter. Number 7 is shorter in women than in men, length of urethra. I'm passing the floor to Miss Daniela Carion.
Thank you, and I'm going to discuss our answers in functional microscopic anatomy of the kidney. Number one, collecting duct is letter E. Number two, glomerulus, letter M. Number three, peritubular capillaries, letter J. Distal convoluted tubule, letter F. Proximal convoluted tubule, letter K. Cortical radiate artery, letter C. Arcuate artery, letter H. Cortical radiate vein, letter B. Afferent arteriole, letter A. Arcuate vein, letter I. Nephron loop, letter G. Afferent arteriole, letter D. Glomerular capsule, letter L. Next. Number 5, identify the following. What is the site of filtrate formation? Glomerulus. Number 2, primary site of tubular reabsorption. Proximal convoluted tubule. Number 3, structure that conveys the processed filtrate to the renal pelvis. Collecting duct. Blood supply that directly receives substances from the tubular cells is peritubular capillaries. Its inner membrane forms part of the filtration membrane. Glom- Glomerular capsule. Number 6. Explain why the glomerulus is such a high-pressure capillary bed. The glomerulus is a uniquely high-pressure capillary bed between afferent and afferent arterioles. Its high pressure is due to the fact that it is the only capillary bed that has both an afferent and afferent arteriole. How does the high pressure help the glomerulus from filtrate? The force of hydrostatic pressure in the glomerulus, the force of pressure exerted from the pressure of the blood vessel itself, is the driving force that pushes filtrate out of the capillaries and into the slits in the nephron. Number 7, what structural modification of certain tubule cells enhances their ability to reabsorb substances from the filter? So their possession of dense microvilli, especially the PCT cells. Next, trace a drop of blood from the time it enters the kidney in the renal artery until it leaves the kidney through the renal vein, renal artery, and then the segmental artery, interlobar arcuate, cortical radiate, afferent arteriole, the glomerulus, afferent arteriole, peritubular capillaries, cortical radiate vein, arcuate vein, interlobar vein, and the renal vein. Number 9, trace the anatomical pathway of molecule of creatinine or metabolic waste from the glomerular capsule to the urethra. Note each microscopic and gross structure it passes through in its travels and include the names of the subdivision of the renal tubule. Glomerular, proximal convoluted tubule, loop of Henle, distal convoluted tubule, collecting duct, minor calyx, major calyx, renal pelvis, ureter, urinary bladder, and urethra. So let's proceed to urinalysis, the characteristics of urine. Number 10, what is the normal volume of urine excreted in 24-hour period? It is 1.1 to 1.8 liters. Number 11, list 3 nitrogenous wastes that are routinely found in the urine. The urea, uric acid, ammonium. List 3 substances that are absent from the urine of healthy individuals. The glucose, amino acid, and blood proteins. Next. List the 2 substances that are routinely found in filtrate but not in the urine product. The glucose and amino acid. Explain why urinalysis is a routine part of any good physical examination. It's used to detect and manage a wide range of disorders such as urinary tract infections, kidney disease, and diabetes. Urinalysis involves checking the appearance, concentration, and content of urine. For example, a urinary tract infection can make urine look cloudy instead of clear. Number 13, what substance is responsible for the normal yellow color of urine? The yellow coloration of urine results from urobilin or urochrome that is produced as a product of bilirubin degradation, specifically urobilinogen metabolized from bile of intestinal bacteria is reabsorbed and oxidized, producing urobilin that is then renally excreted. So number 14, which has a greater specific gravity, 1 ml of urine or 1 ml of distilled water. The answer is 1 ml of urine because it contains dissolved solutes. Number 15, explain the relationship between color, specific gravity, and volume of urine. The lesser the amount of solute, the lower the specific, and the higher the volume of urine, the less color it has. Next. Number 16, how does the urinary tract infection influence urine pH? The specific gravity of a 24-hour specimen of normal urine will be between 1.0, 1.15 and 1.25. Single urine specimens may range from 1.002 to 1.030. The more solids in solution, the higher will be specific gravity. The greater the volume of urine in a 24-hour specimen, the lower will be the specific gravity. Number 17, several specific terms have been used to indicate the presence of abnormal urine constituents. Number 1, blood in the urine, hematuria. Number 2, hemolytic anemia, hemoglobinuria. Number 3, eating a 5 pound of candy at one sitting, glycosuria. Pregnancy, albuminuria. Number 5, starvation, ketonuria. Number 6, urinary tract infection, puria. Number 18, what are renal calculi and what conditions favor their formation? So the kidney stones, urinary retention, urinary tract infection, and alkaline urine causes their formation. Next. So 19, what change would you expect to occur in a urine sample that has been stored at room temperature? So pH will change. So let's proceed to kidneys internal structure. Match each area of the kidney with proper descriptive statements. So number 1, renal cortex, B and H. B is the outer layer of kidney tissue. H is contains the renal corpuscles and convoluted tubules of nephrons. Number 2, renal medulla, C, F, and G. C is the inner layer of kidney tissue. F consists of wedge-shaped pieces called the renal pyramids. And G contains the loops of renal and the collecting tubes of nephrons. Renal pelvis, A, D, and E. A is a cavity formed by the expansion of ureter within the kidney at the hilus. D, the calyces are funnel-shaped extension of this part. And E is urine enters from the papillae of the pyramids. Number 2, parts of the frontal section of a kidney and a magnified wedge of a kidney tissue. So this is your renal pelvis, number 1. Number 2 is renal artery. Number 3 is renal vein. Number 4, ureter. Number 5, renal pyramid. Number 6, renal papillae. Number 7, cortex. Number 8, calyx. Number 9, co- cort- cort- cortex. Number 10, medulla. Number 11, papilla. Number 12, renal corpuscle. Number 13, renal tubular. And number 14 is papillary duct. Next. So let's discuss our answers in the nephron. Nephron. Number 1, A. Nephron are the structural and functional units of the kidneys. B. Each nephron consists of two major parts called the renal corpuscle and the renal tubule. Number 2, a renal corpuscle consists of a capillary network called the glomerulus, which is surrounded by the Bowman's capsule. the expanded end of a renal tubule. Number 3, letter A, blood enters in the glomerulus from an afferent arteriole and leaves the glomerulus by way of an efferent anteriole. Letter B, which of these anterioles has the smallest diameter? Number 4, letter A, the inner layer of Bowman's capsule is made of cells called the podocytes and is very permeable because it has pores. Letter B, the outer layer of Bowman's capsule has no pores and is not permeable. Letter C, the fluid that enters Bowman's capsule from the glomerulus is called the renal filtrate. Next, number the parts of the renal tubule in the order that renal filtrate flows through them. 2. Distal convoluted tubule. 3. Loop of Henle. 3. Collecting tubule. 2. Proximal convoluted tubule. Number 6. Collecting tubules unite to form a papillary duct that empties urine into a calyx of the papillary duct. Number 7. The blood vessels that surround all of the parts of the renal tubule are called the peritubular capillary, and they carry blood that has come from an efferent anteriole. Formation of urine glomerular filtration. Number 1. Glomerular filtration takes place in which major of the nephron? In renal corpuscle. Number 2, letter A. In glomerular filtration, blood pressure forces plasma, dissolved substances, and small proteins out of the blood in glomerulus and into the Bowman's capsule. Next, letter number 2, letter B. The fluid in Bowman's capsule is now called renal filtrate. Letter C. The large components of blood that remain in the blood are large proteins and blood vessels because they are too large to be forced out of the glomerulus. Number 3, letter A, are useful materials such as nutrients and minerals present in renal filtrate? Yes. Letter B, are waste products present in renal filtrate? Yes. Now, letter C, therefore, glomerular filtration is selective in terms of two size, anything small or dissolved in blood plasma may enter the filtrate. Letter D, renal filtrate, therefore, is very similar to the blood plasma from which it is made, except that there is little protein and no blood cells in filtrate. Number 4, letter A, the glomerular filtration rate is the amount of renal filtrate formed by the kidneys in 1 minute and is about 100 to 125 ml per minute. Letter B, if blood flow through the kidneys decreases, the GFR will decrease. Letter C, if blood flow through the kidneys increases, the GFR will increase. So I'm passing the floor to Miss Wem Crisini.
Thank you, Miss Daniela. So we will proceed to the slide 43. Okay, the anatomy of the reproductive system. So it is the gross anatomy of the human male reproductive system. So number one lists down the two principal function of the testis. It is to make sperm as well as hormones, especially testosterone. And then number two, identify all indicated structure or portion of structures in the diagrammatic view of the male system. So we have here the seminal vesicle, the ampulla of ductus deferens, the ejaculatory duct, the prostate gland, the bulb urethral gland, the epidermis, the testis. We have here the urinal bladder, the vas deferens, the urethra, the corpus cavernosum, and then we have here the penis, and we have here the corpora spongiosum glans penis. So next slide. So number three, how might enlargement of the prostate interfere with urination or the man's reproductive ability? So our answer is the bladder's drainage canal is partially blocked by enlarged prostate. Urinary tract infections are more common in older men due to changes in the prostate gland. If the bladder is not entirely evacuated, urine may be back up into the kidneys. And then number four, match the terms. We have here the copulatory organ or the penetrating device. We have here the penis. Number two, it produces sperms. We have here the testis. Number three, the duct conveying sperm to the ejaculatory duct in the spermatic cord. We have here the ductus deferens. And then number four, we have here our urine and semen conduit. We have here the spongy urethra. And then number five, sperm maturation site. We have here the epididymis. And then number six, the location of the testis in adult males. We have here the scrotum. And then number seven, the glans, who's the glans penis. We have here the prepuce. And then we have here number eight, portion of the urethra between the prostate and the penis. We have here the membrane urethra. And then number nine, empties a secretion into the prostatic urethra. We have there the prostate. And then the bulba urethra gland, it empties a secretion into the membrane of the urethra. So next slide, please. So we have here the gross anatomy of the human male reproductive system. So number five, why are the testes located in the scrotum? We have here it's in the scrotum because the scrotum has the colder temperature than the rest of the body, which is the ideal for the sperm. And then number six, describe the composition of semen and name all structures contributing to its information. So our answer is seminal fluid and sperm make up sperm in sperm, uh, citric acid, free amino acid, fructose enzyme, and prostaglandin, zinc, and the potassium are also found in sperm. And the testes create sperm while the prostate, seminal vesicles, and bulbourethral gland produce seminal fluid. And then number seven, of what importance is the fact that the seminal fluid is alkaline? So we have here our answer, seminal fluid protects sperm from the acidity of the female reproductive tract's environment. And then number eight, using the following terms, trace the pathway of the sperm from the testes to the urethra. Read testes, epididymis, seminiferous, and the ductus deferens. And then we have here our answer, the seminiferous tubule, read testes, epididymis, ductus deferens. And then next slide, please. So we have here the gross anatomy of the human female reproductive system. So number nine, parts of the female reproductive system. We have here the um, ovarian blood vessels, and then the fimbriae, and then we have here the ovary, the ureter, the mesometrium of broad ligament, and then we have here in the center we have the um, oviduct or the fallopian tube. And then next is the mesovarium and the ovarian filament. And then we have here on the right side, we have the fundus of the uterus, the round ligament of the uterus. And then we have here the cervix, and then the last one is the vagina. And then next slide, please. Okay, we have here number 10, identify the female reproductive system structure described below. So number one, site of the fetal development. We have here the uterus, the copulatory canal. So we have here the vagina. Then number three, fertilized egg, typically formed here. It is the fallopian tube. And then number four becomes erectile during sexual excitement. It is the clitoris. And then we have here the duct extending superiorly from the uterus. We have the fallopian tube. And then number six, it produces eggs, estrogen, and progesterone. We have here the ovary. And then next, we have here number seven, finger-like ends of the uterine tube. It is the fimbriae. And then number 11, name the structure composing the external genitals or vulva of the female, we have there the mons pubis, the labia majora, the labia minora, and then the clitoris or the external genitals. So we have here the last slide. Next slide, please. So we have number 12. Put the following vestibular perineal structure in their proper order from the anterior to the posterior. So aspect of vaginal, uh, orifice, anus, urethral opening, and the clitoris. So we have here in order the clitoris, the urethral opening, the vaginal orifice, and the anus. And then number 13, name the male structure that is homologous to the female structure named below. So we have here the labia majora. It is the scrotum. Another other way of the in the male and female reproductive system. And then we have here the clitoris, we have the penis, and then the ovaries, we have the testes. And then number 14, assume a couple just consummated the sex act and the man's sperm have been deposited in the woman's vagina. Trace the pathway of the sperm through the female reproductive tract. So we have here the vagina, cervical canal, the lumen of the uterus, the fallopian tubes, the infundibulum, and the fimbriae. And then we have here the last item, define ovulation. We have here, it is the release of oocyte. So I am now passing the floor to Miss Chriselle Caspillo. Thank you, everyone.
Thank you, Miss Crisini. And I will be reporting the microscopic anatomy of selected male and female reproductive organs. Number 16. The testis is divided into a number of lobes by connective tissue. Each of these lobes contains 1 to 4 rete testes, which converge on a tubular region called the seminiferous tubus. Number 17. On the diagram showing the sagittal section of the human testis, correctly identify all structures provided with the leader lines. We have here the ductus deferens, the epididymis, the spermatic cord, blood vessels and nerves, head of epididymis, lobule, root testis, septum. Next, 18. In the female reproductive system, what is a follicle? Our answer is a follicle is a small sac of fluid in the ovaries that contains a developing egg. How are primary and vesicular follicles anatomically different? Our answer, the primary follicles produce estrogen, where areas the vesicular follicles refer to the mature stage, where rising estrogen levels stimulate the release of it. What is a corpus luteum? Our answer is a corpus luteum is a mass of cells that forms in an ovary and is responsible for the production of the hormone progesterone during early pregnancy. The role of the corpus luteum depends on whether or not fertilization occurs. 19. What hormones are produced by the corpus luteum? Our answer is progesterone is the predominant hormone generated by the corpus luteum. However, it also produces inhibin A and estradiol. Next. Next is the deep dive. Number 1, letter A. Mrs. L is a 50 years old and has been feeling pain in the upper right abdominal quadrant after eating. Her doctor suspects that Mrs. L has stones, which accessory organ of digestion, and our answer is the gallbladder. B. Such stones are usually made up of what substance? Our answer is cholesterol. C. If gallstones are producing frequent and severe pain, the most effective procedure is to remove the gallbladder surgically. Next, letter A. Mr. A is a 67 years old and has been hospitalized with diverticulitis. A diverticula, a small outpouchings of the weak-end wall of the colon, and they may become inflamed if a bacteria become trapped within them. B. Mr. A is being treated with antibiotics to prevent further infection and the need for surgery. Mr. F has been diagnosed with hepatitis A. He feels very fatigued, has no appetite, and the whites of his eyes appear yellow. This color is caused by excess bilirubin in the blood, which Mr. F's damaged liver cannot excrete rapidly. Mr. F asks his doctor what causes hepatitis and how he got it. The doctor tells him that the hepatitis is caused by the viral infection and that hepatitis A usually spread from a person to person by sexual contact. Next. 4. Name the digestive disorder suggested by each of these descriptions. Number 1. A 6-month-old baby boy often vomits after his feeding. Our answer is pyloric stenosis. 2. A 40-year-old woman feels abdominal discomfort after eating foods that contains milk. Our answer that lactose intolerance. 3. A very serious infection that may follow a ruptured appendix or a perforated ulcer. Our answer is peritonitis. Clinical application. Number 1, letter A. Urinary tract infections are usually caused by what type of microorganism? Our answer is the Escherichia coli or E. coli. B. These microorganisms are usually part of the normal flora of the person's own. Our answer is the gastrointestinal tract. C. The term nephritase refers to an infection of the. Our answer is kidney. D. The term cystitis refers to infection of the. Our answer is bladder. Next. Clinical. Number 2. Letter A. Mrs. R has been diagnosed with renal calculi, which may also be called blank kidney stones. B. To prevent further formation of stones, Mrs. R will be advised to increase her intake of fluids. Letter C. This will be important to have her kidneys form a dilute urine. Number 3, letter A. Mr. G was in a car accident and lost a great deal of blood. He has been in the intensive care unit for 24 hours and his condition is stable. His doctor, however, is concerned about possible kidney damage and finds these reports about Mr. G. Urinary output in 24 hours is 500 ml. Blood urea nitrogen is elevated. Blood creatinine level is elevated. On the basis of this information, are Mr. G's kidney functioning normally? Our answer is no. Is Mr. G in total renal failure? Yes, since his urinary output is too low, his kidneys are not working well, his blood urea nitrogen is elevated, and also his blood creatinine level is elevated. Next. 4. For each of these possible causes of renal failure, state whether it is prerenal, intrinsic renal, or postrenal. A kidney stone is blocking our ureter. It is a postrenal. An extensive bacterial infection of the kidneys is intrinsic renal. Our ureter becomes twisted is postrenal. Severe hemorrhage is prerenal. A serious side effect of some antibiotics is intrinsic renal. For someone with chronic renal failure, the procedure called dialysis. In this procedure, the patient's blood is passed through a hemodialysis machine to remove waste and excess water. Mr. C is 60 years old and tells his doctor that he is having increasing difficulty urinating. A possible cause of this is enlargement of the prostate gland. This enlargement is called the prostatic hypertrophy. Next. This condition may Urination difficult because the prostate glands surround the first inch of the urethra. The doctor tells Mr. D that the surgical procedure called the tubular ligation is also a very effective method of contraception. In this procedure, the fallopian tube are cut and tied off. The doctor tells Mr. D that the surgical procedure called a vasectomy is also a very effective method of contraceptive. In this procedure, the ductus deferens are cut and tied off. Next, sexually transmitted disease are infectious diseases that are spread from person to person by sexual activity. The STD that is caused by bacterium and if untreated may have serious or even fatal effects on the heart or nervous system is the syphilis. One of the most prevalent STDs in the United States is the chlamydial infection or chlamydial is a type of bacteria. Women with this infection are at greater risk for an ectopic pregnancy. The infants born to these infected women are at risk for developing conjunctivitis or pneumonia. The STD genital herpes is caused by a virus. Newborns who acquire this herpes infection from their mothers during birth are at risk for damage to the nervous system or even death. Breast cancer can often be successfully treated if detected in the early stages. A procedure that can be detect even very small tumors and that is recommended for older women is mammogram. Next, endocrine lists down all the hormones in the body and provide information of the following gland, hormone, targeted organ, respond or function, stimulated by, inhibited by, hypersecretion, and hyposecretion. First is the pituitary gland. Its hormone is the growth hormone. Target organ, liver, bones, and muscle. Response or function, it stimulates somatic growth, mobilize fats, spare glucose. Stimulated by growth hormone releasing hormone. Inhibited by somamidines, insulin like growth factor. Hypersecretion is the gigantism acromegaly, and hypersecretion is dwarfism. Adenophysis or anterior hormone is thyroid stimulating hormone. Target organ is the thyroid. Response or function is it stimulates production of thyroid hormones stimulated by thyrotrophin releasing hormone, inhibited by feedback mechanism. Hypersecretion results to hyperthermia. Hyposecretion is creatinine in children. Hypothalamus, growth hormone releasing hormone. Pituitary gland, maintain homeostasis, help stimulate body key processes, especially the heart rate and blood pressure. The parvocellular secretory cells, pituitary secretion, fast weight gain, excessive weight gain, uncontrollable appetite, appetite temperature, and sleep disorder. Thyroid gland, triodenine and thyroxine and calcitonin. Most tissue, bones, plays a major role in the metabolism, growth, and development, releases steady amount of thyroid hormones in the bloodstream, stimulating thyroid stimulating hormone, thyrophine releasing hormone, and thyroid stimulating hormone. Overproduction of TSH will cause hyperthyroidism and hyperthyroidism. Next is the parathyroid gland, parathyroid hormone, bone, kidneys, and intestine, maintain the body's calcium levels and phosphorus, negative feedback of calcium levels in the blood. High calcium levels in the blood prevent the release of parathyroid hormone, increased levels of blood of phosphorus, and leads to decreased blood levels in calcium of high current. And that would be my report.
So that is all for the report of Group 2 from BSN 111F. We hope that you've learned something from this video. Thank you and God bless.